Hi, and welcome to the first in the series of dental expert interviews for 2022. This first one is entitled How to Help Patients Pay, and we will be introducing you to Michael Gutlove of ERJ Solutions soon, who is an expert in patient financing. So, without further ado, let's talk a little bit about why we chose this topic. First of all, probably because we hear many anecdotes from our clients about the difficulty of getting patients the financing that they need. And obviously, as marketers, that causes us some pain because we would like all of our leads to be closed, obviously, into new patients, and that doesn't always happen. And it also frustrates us because we often don't have the expertise to help. We're like there going, okay, sorry, I guess we'll just generate more leads, and hopefully the next ones will be better. But there are obviously things we can do to help people, and Michael's going to help us understand that. We also wanted to, first of all, clarify with some data from not just from ourselves and our own anecdotes, but from systems like Google. I wanted to show you some of the data that suggests that there is a lot of searching on patient financing for dentistry. I mean, the biggest one there is the almost 15,000 people a month who search for CareCredit dentist. They're actually searching actively for somebody who takes CareCredit because CareCredit is the dominant brand in patient financing. So instead of using the phrase patient financing dentist or dentist with payment plans, although dentist with payment plans is the next one, they will prefer to use the brand name. So that's fine. And that obviously tips us off every week. We see these keywords coming in, and sometimes we utilize them, sometimes we screen against them, but we see them very often. And then I wanted to bring some data from a dental economics article that Jim Philhauer wrote from Henry Schein Business Solutions. And he talks about on the left is the average dental office and what he estimates or worked out from his interviews are the case acceptance rates in existing patients. About 50 to 60% of existing patients, he believes, in an average office will close on a case, will actually do the treatment. And as far as new patients are concerned, he thinks it's as low as maybe 25%. So a new patient comes in, you can give 4 treatment plans and get 1 treatment plan accepted. That's what he believes is the average. And then he says when he sees top tier dentist offices, those numbers just are much superior. And often there's almost no difference between existing and new patients because their systems are so good. They're getting to the point where they can close 80% of their existing treatment plans. And almost the same, almost up to 75% of new patients will end up closing. And I certainly know that of my top dentists, anecdotally, I know that many of them say they're expecting to close 2 out of 3 new patients. If they're sitting in their chair, they give them a treatment plan, they're hoping that 2 out of 3 will close, which is about in the middle of the gold standard there. But again, those are just numbers to have in mind. And we wanted to look at, how can we understand what the motivations are behind people failing to accept cases. And so we found a great AGD document. It's actually a PDF. I've put the source there on the bottom of the page that says there are 4 different reasons for people being blocked on case acceptance and not accepting. The first one is oral health literacy. They just aren't aware of how serious oral health is. Psychological factors, dentophobia, just nervous, just general nervousness about sharp objects inside their mouth. And then patients with special needs. Sometimes that's a structural issue with the office. Sometimes that just means more hands on deck when that particular special needs person comes into the office, and maybe you can or you can't help with that. And then there's the financial burden. So we went through this thinking about, okay, but what happens if somebody's in your chair? If they're in your chair, it seems to us that oral health literacy probably, if you're a good dentist and you're doing your explaining well, you have the time to do that, probably becomes reduced as a factor. You're explaining to them why they need to do what you are telling them to do, and you're explaining the consequences if they don't do it. So that should take away most of the literacy issues. You are making them literate. Psychological factors also seem to fade away. If they've made it through the door, that is a big barrier for people. And again, we're presuming that when you meet with them, you will look like very unlike the Steve Martin dentist character in Little Shop of Horrors, and more like a normal human who wants to not hurt people and wants to be gentle. So you will have definitely eased those psychological factors. I'm not saying that any of these are going away, they're just being reduced. And then patients with special needs, again, if they're in your office, if they made it in, and you have, wheelchair access, or you have other capabilities in terms of accepting special needs patients, if they're in, they already really passed a big threshold right there, and probably there's a good chance that fades into the background as well. What stays as and maybe even increases as a barrier are the financial demands that are being put on people, because that's really when they hear for themselves what the customized treatment plan is, how much that's going to cost, what some of the alternatives are. But really, there's usually a number, and there's usually a little bit of a range. If they can't meet the bottom end of that range, that could be the end of the discussion. So with that said, there was one more piece that we wanted to bring from the ADA: key barriers to dental treatment. As per the ADA, it says AGD there. It's actually the ADA. I've got the source at the bottom. Share of adults skipping care because of cost within the previous 12 months. You can see that dental is up at almost 17%, and medical is at 7.5. I mean, it's dental issues are being put off at double the rate of medical issues, and even it looks like it's triple the rate of mental health issues even. So that's really very dramatic, and I know when I showed that to our guest, he was particularly impressed with that particular graph. And so at that point, I would like to introduce him, Michael Gutlove, principal at ERJ Solutions. For 24 years, Michael has been helping dental practices get paid. There are two areas he has many areas on his resume. We focused it down to traditional standalone credit card processing, which he does, which we're probably not going to talk about now, and patient financing, which we are going to talk about now. Patient financing includes buy now and pay later services. That's also something we're not going to talk about. We're going to really focus on patient financing and on CareCredit alternatives. Welcome, Michael. How are you doing?
David, thank you very much. It's really a pleasure to be part of this series. And I really do want to highlight, I think, that last slide just for a second. If you think about how many practices, dental in particular, were impacted during COVID, when a number of elective procedures for dental were no longer available, the dentists were told that they had to close their offices. It almost gave patients yet another reason not to take care of those treatments that they knew they had to do. And to a certain extent, it made that financial piece even more compelling. So now that, thank God, we're slowly getting our way out of everything that had to do with COVID, and more dentists throughout the country are able to open their doors, they're able to prescribe the treatments that they need for their patients, we should no longer have the financial impact being somewhat of an impediment for patients not to do the treatment that they need. So I'm very excited about going through some of the services that my company is able to offer the dental industry. And yes, as you had mentioned before, I've been doing consulting to dentists and healthcare practitioners for the past 24 years, working primarily in the merchant services space and with a very specific focus as well on patient financing options and buy now, pay later as it relates to the medical field. So yes, very timely, and looking forward to getting into it here.
That's great. Me too. And we've already, just to produce this presentation, we've met several times. Like, we've met many times on a weekly basis, and I feel like I got a financing education from you, Michael. So I'm certainly very grateful for that. Let's get right into it.
Sure.
So explain to us what this chart is. We're going to be comparing PatientFi and CareCredit, and just talk to us a little bit about why we decided to do this.
Sure. So every dentist, every healthcare practitioner, if you're in the medical field, I don't think I have to tell you who or what CareCredit is. I mean, they do a great job of marketing their services. But the reality is, and as I'm sure anybody will attest to, as great as they are, they're not perfect. There are certainly opportunities, especially when it comes to talking to patients, either about cost, either about the process, where if another option existed, what would that look like for the practitioner? Now, we work with a number of different solutions. PatientFi happens to be the one that we're going to focus on today. And really what we want to do is we want to just show the practitioner, we want to show the dental office. You don't necessarily have to eliminate CareCredit, but what would it look like if you had an alternative available for your staff, for your patients? Does this make sense? And more importantly, how would you go about doing it so that you can offer more treatment and finance does not become that primary reason why patients aren't going to get the treatment that they need? So yeah, let's start going through some of the details that compares
Okay.
PatientFi in this case versus CareCredit.
And I just want to insert here as well. We started with, I think we were talking about 3 or 4 different financial instruments, I think is what we would call them, when we first
Yep.
started out. And we really had to cut it down to what I think is the best choice for making a clear comparison with CareCredit, which again is the dominant player in the market. So you really have to look at CareCredit and offer some kind of alternative. And that's what we decided to do.
Right. Yeah.
So
Very,
here, let
very
me
well said.
just
Yes.
move everything forward. Okay, so these are just, so PatientFi is on the left, CareCredit is on the right. Just talk us through the difference in this
Sure.
particular
Sure.
bullet point.
So probably the first thing that everyone that has gone through a CareCredit application or experience will note is the application process, and that application process does require some sort of information on behalf of the patient. Now, that information can impact the patient even if they don't go forward with the treatment, and this is where we're talking about a credit check, whether a social security number is required or some other financial information is required that if they walk away and they say, you know what, this is not for me, well, what exactly did that do to them? PatientFi does not put a hard credit checks on the patient after they fill out the application. So it's almost as if they're doing a soft credit check. There's no impact on the credit score. Whereas what we found with practitioners that offer CareCredit, even if they don't offer the service, they do get an alert. The patient does get an alert that their credit was checked, and that could impact their score. So straight off the bat,
Right.
even before the transactions even happened, we now have a positive experience by way of the application for the patient versus somewhat of a negative experience.
Right. And of course, that's it. That's important for the patient experience in general, is to have a positive experience, even if you end up not being qualified, or even if you end up being qualified, you want to be able to be qualified in a way that doesn't affect other aspects of your life. Keep this siloed. And on this next point, the approval is not based on the credit score at all. It seems for PatientFi. How do they work out if you're credit worthy without a credit score?
Well, that's the interesting thing as far as the process with PatientFi. They're taking a very, I guess you'd call a holistic view of the patient. They're going to get a sense of, well, how much money do they make on a monthly basis? What other sorts of income is coming in? They're not just going to look at that credit score and say thumbs up, thumbs down based off of where you fell. And to that end, they have a little bit more flexibility with regard to when they do get that soft credit check response. They are able to approve more, even if, say, for example, something happened over the past however number of months. PatientFi is looking at the whole patient. They're just not looking at a number. And I don't, want to suggest that, others will say, well, we're looking for a reason not to approve. PatientFi is looking for a reason to approve the patient so that the procedure can actually happen. So it's more of a, full look, holistic look, so to speak, of the patient. Now, this to me is probably, I think, the biggest piece or the biggest reason to have PatientFi in place versus CareCredit. As we've said that, every office that you go to, you'll see the signs, you recognize that CareCredit is available here, but not only is it available here at my dentist, it's also available at the dentist down the block and the dentist 3 blocks from now. So perhaps I get a quote to do some root canal work. I'm in pain. I know I have to get it done. And now I've actually gotten the quote, but it's maybe too much more, a little bit more than what I wanted to pay. However, I've been approved through CareCredit. So what I can do is I can take that approval, I can go down to the dentist down the block or 2 blocks over and say, I'm already approved. Where do I sign up? I see your ad in the white pages. I see it online. You're
Right.
cheaper than the person before, and we can go and off you go. So the office now has basically done some advertising for his competitor. Now, they might be friends, but I surely don't think that they want to divert business from one place to the next.
Right.
PatientFi has an exclusive offer to the practice that's actually offering it. So if two dentists across the street from each other have PatientFi in place, the offer for financing is only good where the patient made that application. And that to me is probably a very compelling argument to keep a program like this in place and offer it primarily so that this way your clients, your patients, aren't shopping around your services to your competitors. Keep your
Right.
patient in your office. They feel comfortable dealing with you. You want to be the one that's going to offer that procedure to them. You don't want to be bidding against the dentist or the practitioners in your neighborhood.
Right. That's a really great point. We actually see quite often that CareCredit does pressure the dentist to put a link to the CareCredit website on the websites that we run. Now, we run mostly landing pages for new patients. So my argument was always, why would we put a link to CareCredit when what we're trying to do is generate a lead here? We're not generating a lead for CareCredit, right? We need to generate a lead for you. The process is not that people go to your website, they go to CareCredit, then they bounce back to you. Like that's such a messed up process. And usually we
Mm-hmm.
end up convincing people that's not the right thing to do, but it's a CareCredit thing to do because CareCredit is interested in CareCredit. So
Right.
let's continue. Uh, so we're going to look at provider and
Mm-hmm.
patient fees later. So perhaps we can just say here, PatientFi has lower fees on both sides. The dentist and the patient pays less, right? And we'll
Mm-hmm.
look at the details of
Perfect.
that.
Good. Yeah. Yeah.
Here we go. We're right here. Maybe just walk us through this pricing schedule. I'm sure that everybody has seen one of these, but it's worth just describing what it shows.
Sure. So this is probably very familiar, as you said, to any office manager or any dentist that has been presented with financing options. You really have two ways that you can finance a procedure. Either, if we look on the left, the practice, the dentist is taking the lion's share or all of the fees. And that's what we're saying, where there's no interest that's paid within the first 6, 12, 18, 24 months. And in that case, the dollar amount, whether it's, let's just pick $500 to $30,000, is then based off of a period of time. This is the payments that the patient is agreeing to make based off of the treatment schedule. And if you're looking at the 6 month fee, and again, this is just specific to dentistry. This is what we've offered to a few offices, in the dental field. They're going to pay that 4.9%. And if you go accordingly from 12, 18, and 24, it can go all the way up to 14.9%. If, for example, the patient misses a payment, then the interest gets calculated at that point. And we'll discuss that a little bit more. But if they make their scheduled payments 6, 12, 18, 24 months, there's no interest that's paid, and that provider fee is the only thing that goes back to PatientFi. So that's scenario A.
And I'll just tell you anecdotally as well that most of our dentists will tell us their preferred plan is the 6 month plan with
Mm-hmm.
zero interest. I think there's two reasons for that. One, it makes them feel good that they're giving the patient zero interest, and the 5%, 4.9% is easy to handle, relatively easy to handle. Once it gets up to 12 months, I have fewer dentists who want to do it at 12 months, but maybe
Mm-hmm.
10% squeezes by. And then once you get to 18 and 24 months, I mean, this is a big disincentive to the dentist to actually allow his or her patients to have that plan.
Right. I mean, you don't want to turn into a bank. I think at the end of the day, a
Yeah,
dentist is in the business of treating patients. These numbers have to make sense not only for the patient, but they have to make sense for the dentist. So I would
right.
agree, just for what we've seen as far as the applications that come through, that 6 month, no interest, 4.9% is certainly the most popular and the most requested program. But in addition to the no interest program, as we look on the right side, you also have a fixed rate term loan, which a patient is going to take out, and they're going to be responsible for the lion's share of the fees, of the interest. And we'll get into this 14.9% as far as the fact that it's fixed regardless of the period of time. So we go 12 over to 60 months, as well as the dollar amount. Once they get approved, then this is what the patient's fee is going to be. This is what their interest is going to be. as they make their payments. And the only sliding scale here is what the provider is going to pay. That 4.9% is going to go for the most popular choices, 12, 24, 36 months. But if it's going to go up to 48 or 5 years, 60 months, then they have that 5.9, 6.9 fee that they're going to pay. And this is all detailed on the application, so there aren't any surprises. There aren't any, well, where did this fee come from? This is part of, I guess you could say, the transparent pricing that both the
Right.
patient and the provider will see at the time of application. They're signing it, they're agreeing to it, and they're able to go through it. Now, here is where we're taking actual, like more of a deep dive. You kind of went back. Okay, so,
Oh, sorry.
so
You want me to stay on here, or do you want me to advance? I'm just dying to get to the next slide because
right.
it's comparative.
So these are great numbers if we just look at them in an abstract, right? But let's now kind of like go under the hood. And this is what we're going to show you now is more of a side-by-side where we actually looked at the statements. We looked at what the practices were paying. We looked at what was being offered directly to the patients. And what we saw was somewhat startling. We saw that, in fact, CareCredit was charging significantly more on the 6 to 24 months. And again, these are on the options of the no interest to the patient because they were making their payments regularly. But what in fact was the dentist office paying? And let's just compare it on a loan amount of $5,000 or $20,000 or $30,000. If we just take that 6-month period where their net effective rate was close to 8%, 7.8%, I mean, you're talking a difference between $390 to $245 on a $5,000 procedure, which might not sound like a lot, but now go to a $30,000 transaction. We're talking, significant money, almost $1,000 difference between the two. So this is where having that independent
those
audit,
are the providers' fees that they will be paying. So the dentists,
right? This is nothing from what the
paying
patient
this,
is paying,
right? So had they used PatientFi on a $30,000 process, they would have paid this fee instead of this fee. So
that is correct.
That's a big boost to profitability.
That is correct. And you just think about how many transactions or how many procedures weren't necessarily approved. So again, these are the ones that actually went through. Think about the ones that they weren't even able to do where they didn't get anything. So we're not only putting more money back into the provider's pocket, but we're also increasing the number of procedures that they're able to do at a lower cost point. So to go back to the earlier points that you had made in the slide, you've gotten them in the chair. You know that they need the work. They agree that they have to do it. Now you shouldn't have to lose your shirt for it because of the fact that that they've been approved. So this is I think like a key piece just to highlight the apples to apples comparison.
One of the things that we actually don't have on this chart, but we had previously, was there seems to be an APR that CareCredit will show people that is very similar to the PatientFi APR, and then they have this 1.9% kind of, they call it something else. It's just like a CareCredit charge that they tack on top.
So this is just going through the statement. This is just kind of pulling out all the other ancillary fees that they get charged. I think, and I use this again not to compare patient financing to merchant services, but the comparison is valid in that sometimes the rate that you see isn't necessarily the rate that you pay. The only way that you really know what you're going to end up paying is by having an auditor, somebody who's independent from the practice, just looking at the numbers from the beginning to end, looking at the statements, and then putting down a deep dive net effective comparison. And that's what we did. And this particular comparison is relative of a number of offices that we've worked with in the past. But certainly it's not to say that this will happen every single time. It speaks to the need to have that independent, look under the hood, so to speak, on what exactly CareCredit is costing versus the alternatives.
Is there a way for people to do this on their own, or is it really that difficult to pull it out? Can they just look at the amount, the amount that was?
Well, they could. I mean, look, I don't want to pretend that what we're presenting is rocket science. I would like to think, or I would imagine that a dentist or any other medical professional would rather spend their time treating patients as opposed to checking up on their vendors that they're doing what they're saying they're going to be doing. This is part of the process. This is part of what the practice actually gets when they have someone such as ERJ Solutions in place, checking their invoices, checking their statements, and making sure that they're paying what they should be paying.
Right. Okay, that's great. That's very enlightening. So everybody should be trying to find out whether it's using you or it's using somebody who helps them financially in general, or whether it's trying to do it themselves from the statements. Try to work out what your effective provider fee is, rather than just looking at the top and saying. I mean, I think people will find that they have maybe 5.9% in the 6-month category, and it says it
Yeah.
on top of the statement. No, the APR is 5.9%. Yes, that's true, but you have other charges that get put on top. So effectively, you're paying 7.8%. That is the effective rate. So that's really what you want to look at. And it actually just occurred to me as we were seeing this for the 94th time that was an important thing to point out to people: the effective provider fee rather than what they say the APR is, or the provider
The
fee.
devil is in the details, and
Yeah,
specifically when it comes to these transactions, what I've found over the years is there's what you think you're paying, and then there's what you're actually paying. And
right,
sometimes that aha moment, is enlightening. It's a little bit frustrating sometimes, but at the end of the day, you want to do the procedure, you want to make sure that you're getting paid, and you want to make sure you're getting paid at a fair rate.
right. Okay, great. Let's move on. This is a little bit about you, and you touched on this earlier on the
Hmm.
kind of the moving APR rates, and we just underlined for CareCredit, and I think we pulled this from one of their own documents, that there are 4 different APRs in this one short paragraph, really, where they float
Yeah.
between them. What are they actually doing here? What's that based on?
Well, at the end of the day, when they run a patient's credit, when they've now been able to kind of pinpoint how many months is this treatment going to go for, what's the dollar amount that is actually going to be financed, they start creating different buckets. And those buckets are ultimately going to be what the patient is going to pay. So if we went all the way to the extreme, 60 months, and let's just kind of put their credit for a side, but they've been approved, the patient is now going to pay that 17.90% on the payments that they're going to make. And if they were to miss a payment, and we don't even have the language here stating that, but it's a key point just to highlight, there is going to be compounding interest calculated from the day of the procedure. So let's say you're in month 40 and a payment is missed, they're going to go all the way back to month 1, and that's going to get tacked on.
Well,
So that's a
and
significant thing to
and that
keep
is
in
not the
mind because the
case.
patient, yeah, and that's
That
not
is
the
not the
case with
case
patient
with
fund.
with PatientFi.
Right.
Okay.
PatientFi, 14.9%, regardless of the dollar amount that's approved, regardless amount of the term, and there is no deferred interest put on top. This is the very key piece, and that's spelled out specifically to the patient
Right.
once they fill out the application. So it shouldn't be where, now all of a sudden there's some guesswork as far as what this is going to end up costing the patient. We make this as clear as possible during the application process,
Mhm.
so that the patient and the provider, for that matter, knows. Because at the end of the day, who is the patient going to complain to? They're not going to complain to CareCredit. They're going to call up the dentist. They're going to complain to the front desk, or they're going to put a nasty review somewhere. And in the end, this could have certainly been avoided had this all been spelled out from the get-go, and it was very clear to the patient. So you don't want to have that sliding scale. It certainly makes it a
That's
more complicated process just to get this treatment done.
right. Okay. Fascinating. It's amazing when you're the leader in a market how you can effectively gouge the market like that and do essentially whatever you want. Um, so let's talk a little bit about some frequently asked questions that come up.
Sure, sure.
The patient application process for PatientFi, and that's just a question mark. I presume the full question is,
Hmm.
how easy is it? This is about ease. As easy as CareCredit. I mean, at least
I
I
would
guess
say it's
people are
even
hoping.
easier. I mean, we've
Yeah.
seen offices have to go through, I don't want to say extensive training, but they need to know what to pull, how to pull it, where does this information go, how are they tracking this. Everything from PatientFi is done online. It's done immediately once the patient has been able to fill out some information that they either can get on their phone, they could get it on, sent to them at home if they want to. And as we said earlier, there's no impact to their credit once they click submit. So they could even be doing this at home. They know that they have a procedure that they have to do. A link could be sent out from the office, maybe in advance from when the patient actually comes in. Maybe they're waiting in the parking lot or a day before just to confirm, for the appointments. And at that point, they're going in there and they have everything that's done, and the treatment can be done, immediately, depending on, how they work it out with the doctor. But yes, the process is extremely easy, extremely streamlined, and it's done digitally. No paper going back and forth, as
Right,
far as
great.
signing is concerned.
Great, and that's always a benefit to me as well. The dentist and the doctor is the only place where I actually have to use a pen these days, and it drives me a little bit crazy. So anything that can be digital, I mean, I cannot handwrite anymore, so that's a problem that I'm sure
I've
other
seen
people
the way
share.
doctors and dentists write. I would make the argument I don't think they can do handwriting that well either.
Right,
I'm sure
right.
they'll agree with that.
Um, So, any extra fees on patient file loan? We talked about the extra bump, the
Mhm.
1.9% that the CareCredit adds as like their special CareCredit fee. Anything else with patient fi? Looks like no.
Nothing that none of these gotcha type fees, none of these gotcha clauses.
Right,
At the end of the day, PatientFi is in the business to approve treatment for on behalf of patients, and they're not going to add any additional setup fees or documentation fees or who know what type fees.
yeah,
Their fee structure is detailed from the get go. Each application kind of stands on its own. And the patient sees it, the doctor sees it, the office sees it. Nothing that that kind of makes you like ask yourself, well, what am I getting charged for this?
right. And then this was my question at the end. I don't know if it was frequently asked, but it was asked by me because it's a transparency question, right? Why go through you in order to set up patient fi? Um, instead of just Googling patient fi, I guess we'll pull up the patient fi website,
Mm-hmm.
which people are welcome to go check out. Why do they not just call up patient fi and say, hey, I'm interested? Um, what's apart from the fact that that feels a little immoral since you introduced them to it, but
Well, I
what
wouldn't
do
be
you say to
surprised. I
that?
mean, we're 30 minutes into this presentation, so I'm sure that at least a good chunk of the people who are watching this right now have probably Googled and said, "Oh, this looks good. What do I need, Michael?
Right,
What do I need ERJ solutions for?" What I would say to that is, in truth, yes, you certainly could reach out directly to PatientFi or any other provider for that matter, but you sometimes kind of get that 1-800 good luck type of approach where you're never really sure if you're going to speak to the same person if you have a question. You might want to get a sense of, well, can you walk me through this? I'm not an expert in this particular piece of the business. I know my practice, I know dentistry, or I know cosmetic dentistry. Can you help me with this? It doesn't cost you, the practice, anymore to have ERJ solutions guiding you through this process. We'll look at other pieces of your business if you're interested. How are you accepting credit cards? Are you offering other types of buy now, pay later type services? Credit card processing in general, merchant services by design is a
right.
complicated industry. I mean, the credit card companies want to do it, that particular way. So you have this added resource which doesn't cost you any more, walking you through the different solutions that are available. And it could very well be that we discover that maybe something besides or in tandem to PatientFi makes sense for your office. As we mentioned earlier, there are other solutions that are kind of in the war chest that ERJ offers. Perhaps you have patients that have extremely poor credit and they wouldn't get approved anywhere they went. Is there something that we can talk about? So you get that additional resource, that additional, those additional quivers, so to speak, like for your arrows, in order to be able to approach different solutions as they come up.
Great. And I would add one other thing, which is that over time, patient fi, if it's right for you right now, may become something that is improved upon by another tool, and that tool would come into your, quiver of arrows. I'm like mixing my
Mhm.
metaphors here.
Right.
But you would have been able, if you had got them onto CareCredit 10 years ago, let's say, when maybe CareCredit made sense, you would have already a few years ago introduced them to patient fi and said, listen, for all the reasons we took CareCredit 10 years ago, there are now better tools. Let's move on. So you're
Right.
with them the whole way, and I know you like I like long-term clients for, 10, 15 years to be able to, keep on improving things. One of the reasons that consultants are so great. So
And that's
great.
that's the that's the trick really to how ERJ Solutions has been able to remain relevant over the past 24 years. At the end of the day, we work for what's best for our clients. Our clients will tell us what they're seeing. They'll tell us their pain points, what's working, what isn't working, and
Right.
that's what pushes me and David. I'm sure it pushes you the same way to keep finding solutions for your clients so that they're able to do what they love to do.
Right. Absolutely. To me, it's a no-brainer. Let's let's just have a quick look at the offer, because I want people to be able to get in touch with you directly. We put your text number at the bottom, which again, texting is the best. Email, terrible. Do not use email. If you expect, do not expect delivery with email. You can expect delivery with text. So
Mm-hmm.
you can text Michael, and I guess they can try their hand at calling you as well. But I know you're a busy guy. And there's the website address. And then talk to us a little bit about these three pieces here that you're offering. Um,
Sure. So we're going to start just having a conversation on what you're offering now for financing. What does it look like when a patient says to you, you know what, that costs a lot of money. Do you have a financing option? Let's look and see what you're getting charged every single month, whether it's CareCredit, it could be somebody else for that matter. How much is it costing you? And let's kind of put that side to side, apples to apples on your financing. While we're doing the side-by-side review, we're also going to look at your merchant services. We're going to look and see how much is it costing you when a transaction is done in person. If the patients call up and they're giving their card numbers over the phone, how else is the practice getting paid? With regard to credit cards or ACH fees, we want to take a full picture look on how the accounts receivable are being managed with regard to patient balances. And as an offer, really exclusive, kind of here we're going, to web marketing for dentists. We're going to offer a free hosted page setup with contactless payment options. Whether it's setting up a QR code at the office so that patients don't have to take their credit card out and hand it over the desk. Whether it's going to be the opportunity to put a link on a website so patients can either pay their balance or they can make a one-time payment. We want to try and remove that process of calling into the office and giving your information over the phone. You certainly don't want to be storing credit card numbers on post-it notes on patients' files. So we'll walk you through that. And all of that is complimentary, through looking at the entire analysis process and then suggesting some options. So yeah, so definitely, certainly worth, 5-10 minutes. Shoot me a text. You can look at our website. There's a contact us form. If you want email, I'm happy to give it to you offline so David doesn't know about it. But please, by all means, reach out.
right.
Happy to talk to you and getting a sense on how you're getting paid.
Well, I'm happy about that. People can text and say, "What's your email address?" and then you can just follow up with them a few days later and say, "I didn't get your email."
That's a compromise. There you go. There you go. Okay, good.
Okay, Michael, it was tremendous spending. It has been a few weeks. We've been meeting kind of every week. It's been tremendous finding out about patient financing through you and working out that there are other options besides CareCredit that are really worth being really their first option. We didn't really mention that, but this is not saying that you should have a backup to CareCredit. It's saying that something should go first in front of CareCredit and maybe even
Right.
supersede CareCredit. I think that's how most people are using it. It's the first port of call. But
Sure.
it's been tremendous talking to you. I appreciate you being one of our dental experts. And certainly, if anything else comes up, we will have you back on. You'll keep me abreast of developments and let me know if there's anything else that's awesome in the marketplace, and we'll get that out to our dentists as soon as possible. So thank you very much
Absolutely.
for that.
David, thank you very much. This has been a great experience getting to know you, getting to know your team, and definitely looking forward to serving as that payments professional for you and for your clients.
That's great. If we could do it for our clients, we would do it ourselves, but we cannot. We cannot compete with Michael Gutlove in this area. So, one other thing that I just wanted to say, besides a thank you to everybody for listening to this, if you have made it this far, you may want to text me if you are an expert. If you are a dental expert of some kind and you would like to be in part of this series, please text me. Again, I don't like email so much. We will eventually email together, but text me first at that number, 786-529-5955. Also, if you have any questions, if you have any queries, if you want to get through to Michael and you really want his email address only, I will send it to you, but you'll have to text me first. And any questions on what we asked, any suggestions for what we might have as future dental experts online. If you're a dentist and you know a dental expert, tell me who it is, introduce me. We are trying to do our best to fill in the gaps in our dental expertise, which are large, since we are really marketers. Okay, that's great. Thank you very much. Thank you again, Michael, and thank you everybody for tuning in.
Thank you. Have a great day, everybody.